My people, welcome to Splendid Ade TV. I never see church like this wey be say doctor, they go invite doctor to come talk to members of the church on how to take care of themselves. This church na one kind gboza church wey I like well well. My people, listen, if you get diabetes, BP or cancer, sit down well well, make you carry your popcorn, make you listen to wetin doctor say make we dey do to how to protect our health concerning BP, diabetes and cancer. Sit down make you listen to the end.
To you, Lord, be all honor, all glory, and all majesty in the name of Jesus. Thank you. Please sit down. I want to thank God again for bringing us together. And I thank God that we are going to talk about our health today. Let me thank our chaplain and the clergy for granting me this wonderful opportunity to talk to us about our health. By the special grace of God, we'll go through a few things and then we'll take some questions. Health is very, very important, and it has been discussed in the Bible. From the lessons we read, 3 John verse 2 reminds us that in spite of everything, we should equally think about our health. And it talks about, says, beloved, I wish above all things that thou mayest prosper and be in health, even as thy soul prospereth. That means that God wants us to be in good health. God wants us to be his apostles, but your body, your health, is the vehicle with which you will deliver what God has sent you to do. And we equally read in Exodus chapter 15, verse 26. And said, if thou shalt diligently hearken to the voice of the Lord thy God, and will do that which is right in his sight, and will give ear to his commandments, and keep all his statutes, I will put none of these diseases upon thee, which I have brought upon the Egyptians. For I am the Lord that healeth thee. So that means that the first step in sustaining your health is to obey the word of God. Then we go ahead. Let's look at Jeremiah chapter 8, verse 22. Jeremiah 8, verse 22. Now it reads, is there no balm in Gilead? Is there no physician there? Why then is not the health of the daughter of my people recovered? Is there no physician there? And that explains why I am here. At least there's a physician here to tell you about your health. We'll go through a few of the common problems we encounter in the hospital. Few of the basic health issues, and then we talk about the cancers. Let's talk about hypertension. Hypertension is also referred to as raised blood pressure. And it is very, very common in our society. It is said that about 20 to 30% of us are hypertensive. That means it is a very big problem. And we regard it as a big problem because not just that the blood pressure is raised, but if you don't handle it very well, there are some complications that can arise from it. And what are these complications? Now, when the blood pressure is high, then it puts a lot of strain on the heart. Put a lot of strain on the heart. Because it is a heart that pumps blood to the tissues. What then will happen is that the heart will start to labor. The heart will start to labor. And eventually, before you know it, it will fail. So one of the complications of this blood pressure issue is heart disease. And hypertensive heart disease is one of the commonest causes of heart failure in our own environment. Of course, when the blood pressure is raised, it can equally affect other organs of the body. It can affect the kidneys, as we'll see later. Hypertension constitutes one of the most common causes of kidney failure. I'm sure that of recent you would have been hearing about kidney failure. Failures, the kidneys are failing. And in fact, even in our own climate, this has put us in a very difficult situation. And this has even gone international when one of our politicians, high-ranking politicians, and the wife, they are serving jail terms in UK now because of issue of kidney failure. Then, of course, when the blood pressure is high, it can result in what is referred to as stroke, cerebrovascular accident. And this happens when either there's a blood clot that obstructs the vessels that supply the brain, or in extreme cases, when there is rupture of that vessel and the patient bleeds into the brain. That is what is referred to as stroke. Of course, we know that when the blood pressure is high, it can equally affect the eyes, and people will have problem with their eyes. So, and hypertension and diabetes are like two twin evils. They tend to go together. So what are the causes of hypertension? Hypertension, we can say there are two broad groups of hypertension. One is referred to as the primary hypertension, and then the secondary hypertension. The primary hypertension, there's really no cause as such, can be alluded to it, but we know about some predisposing factors. The secondary hypertension is when there's a problem somewhere, either the kidneys are not functioning well, or the adrenals are not functioning well, and the blood pressure will just go up like that. About 95% of these cases of hypertension, you will not be able to tell the exact cause. Now, but there are risk factors. What is a risk factor? A risk factor is anything that increases your chances of getting an illness. Anything that increases your chances of getting an illness is referred to as a risk factor. And of this, we divide into two broad groups: the modifiable risk factors and the non-modifiable risk factors. The non-modifiable are things you cannot help, things that are inbuilt in you, which you may not be able to change. But the modifiable risk factors are those which, if you work hard and you abide by the rules of the game, then you are not likely to have that illness. Now, the non-modifiable factors, one of them is age. Blood pressure, hypertension, is more common in the older age group. Then, of course, at times it runs in families. There are some families who, are prone to hypertension. You find that Virtually everybody in the family will develop hypertension at any point in time. Now, what are the modifiable risk factors? One of them is your lifestyle. Lifestyle is very, very important. It is said that even the genetic aspect of it, the one you think you have inherited, can still be controlled if you have a good lifestyle. To put it one way, people said genetics may load the gun, would load it with bullets, but it is lifestyle that pulls the trigger. In other words, even if the gun is loaded, if you handle yourself very well, you may not pull the trigger and that problem may not arise. Now, diet. There are certain things, if you look around now, you discover that many of the problems we are having now were not with our forefathers. Our forefathers lived healthier lives, even though you say more primitive lives than we do. Our forefathers were healthier and they lived longer. What is the difference? One of them is the diet. Now, these days, with modernization, we have adopted the Oyibo lifestyle. And because we have adopted the Oyibo lifestyle, we have equally imported, as it were, the Oyibo diseases. All right? Those days, our forebears used to eat a lot of fruits, vegetables, fresh food. But these days, we go for meat pie, we go for Coke, with margarine and what have you. Those ones are not very good. Now, there are three evils. One is flour. Anything that contains flour may not be too good. So all these are meat pies, donuts, and what have you. They are not very good for our health. Then, of course, we have sugar. Not good for our health. And then we have salt. Salt in particular, in relation to hypertension, is a very bad thing. Some of us, once we get to the table to eat, the first thing would be to take up the salt container and we start potting. All right? Now, salt will give rise to retention of water, and that will increase your blood pressure. Then, fat, saturated fat. One of the problems with all these fried things is that they are produced with saturated fat, which is not very good for us. Now, the cholesterol level, when it is raised, it predisposes to all these problems, heart disease, hypertension. So, lifestyle is very important. Diet, number one. Then the other thing is exercise. Exercise. Remember that our forebears, they used to trek many kilometers to the farm. A lot of exercise. Their farming was the primitive type. They would use their hoes. They would till. Expending a lot of energy. But in our own case, if somebody wants to go to UBTH gate from here, you start looking for a vehicle. Those days when we had Okada, they mounted on Okada to even get to the hostel. No exercise. All right? So it is a part of our problem. Let us learn to exercise. Now, what is the best form of exercise? Well, you have various types of exercise. Let's talk about the aerobic exercise, where you have to, walk, jog, and what have you. This will improve the functioning of your heart, and it will help to reduce the blood pressure. So these are the things, the measures we need to take. Now, diagnosis is very straightforward. Make sure you check your blood pressure regularly. We normally have a cutoff point of 140 over 90. You say, well, if it is below 140, 90, you're okay. But these days, particularly in young people, it's been discovered that even that level, those readings may not be too appropriate. We now assume 130 over 80. So try as much as possible to maintain your blood pressure in that manner. And anytime you notice that your blood pressure is raised, then you need to see a physician. The physician will need to carry out some tests. You know, in addition to checking your blood pressure, we'll check if there are complications that will have arisen based on that hypertension. You carry out tests to look at your kidneys, tests to look at your heart, and as we said earlier on, hypertension many a time is really associated with diabetes mellitus. Now, when you will have been certified that all those ones are not there, we place you on drugs. And please, make sure you take your drugs regularly. There's a problem we normally have in medicine. You place a patient on drugs for hypertension. Of course, the drugs would naturally bring down the blood pressure. And the patient assumes thereafter that he has been healed and will stop taking the drugs. What will you notice? The blood pressure will spring up. It is just like a spring. A spring. As long as you apply pressure to it, it depresses. But as soon as you remove the pressure, it springs up. And the major fear about this is that once there's a rebound like that, then this patient may be prone to complications of hypertension, particularly stroke. Particularly stroke. So, never you play with your drugs. Even if you feel your blood pressure is going low based on the drugs you're taking, go and see your physician. He will be the one to know how to adjust your treatment to fit into your state of blood pressure. So that's it for blood pressure. Remember, stroke. Once it happens, it is believed that every minute counts. Every minute counts in stroke. As we said earlier on, in stroke, you have two types. One, when the person has exploded, as it were, within the brain, owing to the pressure. Then, of course, if there is hypertension, it damages the lining of the vessels so that blood clots are formed. And when these blood clots are transported to the brain and they block the vessels supplying a particular part of the brain, then that is what you know as stroke. Depending on the part of the body of the brain that is obstructed, it will manifest. Maybe paralysis on one part of the body. Maybe the eyes. But more importantly, there's a part of the brain we refer to as the speech area of the brain. If the blood supply to that area gets blocked, then this patient may not be able to talk. And we know that the earlier the treatment starts, the better. I know what happens in our own environment. People will tell you, a stroke, don't take them to the hospital. Take them to our native people. You go to the native doctors, they'll start playing their oracle, and then they will tell you, well, you see, That's your neighbor. That's your neighbor. Now him cause this one. All right? Go bring goat. Go do this one. Go do that one. Before they know it, the cells will go bad. And once the cells die, the cells of the brain are very sensitive. Regeneration is extremely difficult. And that is why you find that people who have these problems take a long time to recover. So we don't pray we'll have that type of situation. When we do, let us get to the hospital immediately. But most importantly, let us try and prevent this by taking care of our bodies. We go to diabetes mellitus. Diabetes mellitus is very common. Very, very common. And as we know, in diabetes, the blood sugar level is usually raised high above normal. Now, the blood sugar is regulated by a hormone called insulin. And insulin is secreted by the pancreas. Diabetes will occur when either the pancreas is no longer secreting insulin, or even when it's secreting insulin, this insulin may not be enough in quantity to take care of the sugar requirement of the body. Or there may be resistance. At times there's resistance to this insulin. And insulin, to put it in plain language, if you have a room, you have a door. Now, through that door, well, the room is the cell. The minute structure of the body is called the cell. It has a door that allows the insulin to get in. Now, that allows the sugar to get in, sorry. Now, insulin is the key that opens that door. If you don't have insulin, then sugar will just pile up, will not be able to enter the cell. And therefore you have a situation where somebody is starving. Somebody is really starving, despite the fact that there is sugar everywhere. In fact, when we were young, we had this saying, water, water, water everywhere, but none to drink, by Eliot. In our own language, we say in Nigeria, there is wealth, wealth, wealth everywhere, yet we are suffering. In the case of the diabetic, sugar, sugar, sugar everywhere, and yet the diabetic is dying of hunger. Because that insulin that opens the door for sugar to enter into the cells and give him energy, give him all the things he requires, is no longer effective. So, what are the types of diabetes? We'll talk about 3 types of diabetes. There is one that is called type 1 diabetes. This one occurs in children. It occurs in children. And when it happens, it means that the pancreas is actually destroyed. It's not secreting insulin at all. Not secreting insulin at all. And what could damage the pancreas? Some people talk about viral infections and so on in childhood will damage the pancreas. Now, because the pancreas is not secreting insulin at all, it means that this child will actually require insulin. No other alternative will require insulin. But this problem may not manifest immediately because the pancreatic reserve is very high. It starts manifesting when about 80 to 90% of the pancreas is destroyed. That is when it will manifest. Then we have type 2 diabetes. It used to be referred to as the adult onset diabetes mellitus. And it's very, very common. It's very common. We have discovered that it's not really that the insulin is not there. The pancreas is functioning. But 2 problems. cause. One, either the pancreas is not secreting enough of the insulin, not producing enough of insulin to take care of the sugar requirements. Or two, when there is a relative resistance to, the insulin, somehow something just obstructs that door. Insulin is not able to open it. Insulin is the key that opens the door, and something just obstructs. So insulin, you can't enter. So even though the insulin may be there, this patient will have diabetes. Then there's what we call gestational diabetes. This occurs in pregnant women. When a woman is pregnant, because of the pathophysiology, this patient's blood sugar may go high. But the good thing about it is that if it is well managed, after delivery, it tends to go down. But then, it means that that patient is a potential candidate for diabetes mellitus and should be handled very well. What are the symptoms, the signs? Patient with diabetes, will always be thirsty, take a lot of water, and then because the kidneys are secreting the load of sugar, the patient will be urinating very, very often. Then, of course, this patient, as we said earlier on, is dying of hunger. There is glucose all over, but it's not utilizing it. So, this patient is dying of hunger. But the interesting thing is that the appetite is voracious. Because patient is hungry, we'll be eating and eating and eating, yet we'll be losing weight. And then, of course, this patient is prone to infection. All sorts of infection can occur with this problem. Now, there are some complications associated with diabetes. Diabetes will damage the walls of the vessels, walls of the blood vessels, and this could predispose to hypertension, to formation of things that will narrow the blood vessel. And once this is narrowed, it means that the blood supply to the tissues will be reduced. And that affects many organs of the body. Excess sugar will affect the nerves. All right? It will affect the nerves, and the patient is prone to infection. So, as we said earlier on, this patient will be prone to kidney disease. This patient will be prone to hypertension. This patient will be prone to problems with the eyes, called retinopathy. This patient will be prone to ulcers. We said earlier on that diabetes will predispose to a lot of infection, particularly around the feet. The patient will have one small blister, but because the rate of healing is very, very slow, and the blisters occur because one, the nerves are gone. So the patient can step on something that is supposed to hurt, but we not know because the nerves are gone. And then, of course, the blood vessels that are supposed to aid the healing already gone. And of course, patient is prone to infection. That is why, particularly around the feet, we have to be very, very careful. Infection can spread from there and will keep spreading if not well handled. And we know that diabetes mellitus is one of the most common indications for amputation. Most common indications for amputation. The problem is that with just a small boil, but if not well handled, it will spread. So diabetes is not a very good thing. But then, what can we do about it? Monitor your blood sugar regularly and consult a doctor. If you feel it is high, the doctor will know what to do. And then, of course, doctor may decide to place you on drugs. when it comes to the treatment, remember that it is not every case of diabetes mellitus that should be on drugs. There are some other things that can be done. One is diet. The doctor will tell you what form of diet to take. All right? If you control your diet, take less of carbohydrates. Of course, if you have diabetes and you start taking soft drinks and so on, you start taking donuts, what are you doing? You are committing suicide. So, diet is very important. Fruits, vegetables, and so on. Then, of course, exercise. Exercise will always have on exercise. Very important, because when you are exercising your muscles are consuming sugar. Sugar will be entering into the cells and will help to reduce the blood sugar level. So in fact, many diabetics, just with diet and exercise, will be able to handle themselves. The other way you can handle diabetes is by weight, by controlling your weight. Mark it. Obesity is not a very good thing. Unfortunately, we worship obesity a lot in our environment. And a man is judged not necessarily by the size of his pocket, but by how big he is. All right? I know those days, a young lady gets married. They say, this one too lean now. They will send her to a fattening room. She'll be there for weeks. And by the time she's coming out, you see her like that. They say, yes, this is our bride. We are laying a very bad foundation. Obesity is a killer now. Particularly obesity around the abdomen. You're predisposed to hypertension, cholesterol level will be high, we're predisposed with diabetes mellitus. So, controlling your weight is another thing you can do. Now, when you see your doctor, he will advise you whether you be on tablets, right, or whether you be on insulin. Many a time, tablets which help to lower sugar level will help. Now, but when it comes to childhood diabetes, of course, as I said earlier on, no alternative to insulin. Or when a patient develops one complication or the other, even if that patient had been on tablets, you have to convert to insulin for a while until everything stabilizes before you revert to the tablets. Now, what happens when you are taking these drugs? You have to be very, very careful, because some complications can occur from the taking of these drugs. Make sure that you eat as prescribed while taking the drug, because one of the problems is that the blood sugar could fall so low, we call it hypoglycemia, could fall so low, and you see the patient fainting, collapsing. I remember one day we went for a party, we were invited, and by the time we got there, the hostess, was panting, was sweating, and could not come out. So it was then they called me. I discussed with her. She was a diabetic. Then what happened on that day was that she took her medicine, but in the maze of activities, preparing the fried rice, making sure the salad was well prepared, she forgot to eat. So she was fainting. And quickly, I made the diagnosis. And what did I do? I said, get me a bottle of Coke. I just gave her that Coke. Midway, mid-bottle, she opened her eyes and recovered. It was then the husband revealed a secret to me. He said, you see, that is why when we are listing the people we are going to invite for one party or the other, we make sure we include a doctor. Make sure we meet the doctor so that if there's a problem like this, the doctor will handle it. It's just that the doctor will not be paid. All they will do will be to make sure that they load his plate with fried rice, good meat, and what have you. So, when next you are organizing a party, make sure you have a doctor. And if I'm the one around, make sure you invite me. So, diabetes, hypertension, they are the basic things we'll talk about. Now, for want of time, you can bring up some other issues later. Let us go to cancers. Cancers are ravaging everywhere. Many people are dying of cancer. Now, what happens in cancer is that one cell, one single cell in the organ will just start multiplying haywire. Usually, the body has a mechanism by which to control these cells. That's what we refer to as programmed cell death. Some people will call it apoptosis, but it's programmed cell death. The body knows when the cell will die. But somehow, when there is a change in the DNA, which we refer to as mutation, that cell will no longer be able to respond to any, instruction from these mechanisms. We just start multiplying. And before you know it, it has formed cancer. And unfortunately, it will not even end there. Gradually, some of those cells will push themselves through the blood vessels, and the blood will carry them to other parts of the body. These cells may be lodged in the lungs, may be lodged in the bones, may be lodged in the liver, and of course, wherever they are very rascally. They just continue to multiply wherever they are. And that is why cancer spreads to other parts of the body. But the point is, it is very, very important to detect this cancer before it spreads. Now, what are the causes of cancer? One of them is genetics, familial. Some cancers, about 5 to 10% of cancers run in families. And that is why if you have had a close relative, maybe with breast cancer, colon cancer, prostate cancer, then it is a signal, it's a red flag that you need to watch yourself very well. Because some of these things run in family. But that does not mean that every other person in that family or in that lineage will get it. But the chances are higher that you get it. Then, of course, we have those ones that we will be able to prevent. Those ones we will be able to prevent. And cancers tend to increase with age. If you notice, the older age group tend to be more prone to cancer than the younger age group. Because as one ages, that is how cells equally age. That is how the immunity of the body that is supposed to be destroying these rascally cells, immunity is going down. So these factors, may explain why this condition may be more than the other. So age is one of them. And then, of course, we have our sex. Some cancers are more common in one sex or the other. Then, for instance, cancer of the breast, of course, is predominantly found in women. Only about 1 to 2% of men will have breast cancer. What about prostate cancer? Can a woman have prostate cancer? You see? Cervical cancer. Can a man have cervical cancer? sex is equally important. And then, of course, we still have on those basic things. Lifestyle is very, very important. All those things we talked about in lifestyle, all those ones affect, the development of cancer. If you have a good lifestyle, you may not have some of these things. Right? We've talked about diet. We've talked about exercise. Now, what about smoking? That person that puffs, of course, will be prone to so many cancers, particularly cancer of the lung. Cancer of the lung. More prone to it. But occasionally, you may find somebody who has not smoked will have cancer of the lung. That's because there are some other things in the air which could be inhaled and result in some of these problems. Then we have viral infections. I'm sure you've heard about human papilloma virus being a causative factor of cancer of the cervix. And that is why we're now saying that there's a vaccine, and it is good to inoculate our young females, 9 to 14. 9 to 14 should have this vaccine, and then for those who are older, they could be going for regular checks. We have the hepatitis virus, which could predispose to this problem, particularly cancer of the liver. That can give rise to it. There is this aflatoxin. Aflatoxin is like a mold. It's a mold, found in grains that have not been well stored. Grains that have not been well stored. It is a predisposing factor to particularly cancer of the liver. We have H. pylori. It's a bacterium that can predispose to some cancers, maybe of the stomach, of the pancreas, and so on. So there are so many problems that can lead to these cancers. Now, having given you an overview of this problem, I may just want to mention a few of these cancers before we round up. Now, cancer of the breast. That is the most common cancer in females. And it is so heartrending when you see young females, not necessarily, elderly females are there, but young ones are only coming up. I have seen cancer of the breast in teenagers, 18-year-olds, presented with cancer of the breast. Right? So, it is a devastating disease, which is best prevented, and the best way to prevent it is early diagnosis. How does it present? It could present maybe with breast lump, present maybe with discharge of bloody fluid from the nipple, right? And when you look at the skin of the breast, there could be some changes which you may not appreciate. And then, of course, when it has spread, the first port of call is usually the armpit. It will present with what we call axillary lymphadenopathy. The lymph nodes will get enlarged. And at times, a patient will present to you with just swelling around the armpit. And if a woman presents with swelling around the armpit, the first area you will check should be the breast. I remember some years ago, a patient came to me complaining of axillary swelling around the armpit. I examined her, and I found a small lump around the breast. I knew that that lump was the cause. So I left that armpit and went for that lump. Carried out the biopsy. The only problem I had with this patient was that when she started having pain, she started shouting in the ward. I don't know which kind of doctor be this, so I said, now armpit, they pain me, go cut my breast. But that was the cause of the problem. Some other person would just have gone to remove that and asked her to go. We discovered she had cancer of the breast. All right? So it could present in that way. And then some of them will present with evidence of spread to other organs of the body. Cancer of the breast can spread to the liver, and in extreme cases, patient will be jaundiced, and spread to the bone. This patient will be having back pain, will not be able to walk in the extreme, and can spread to the lungs. Patient will not be able to breathe. Okay? So, when you notice anything around the breast, please go and see a doctor. Don't be afraid. People have this belief. They say, once you see a doctor, that doctor will say, I want to remove your breast. No. It is not all cases of cancer of the breast that will require removal of the breast. If a patient comes early enough, we may be able to dissect out that lesion. It is small. We send it to the lab, and if we are certified, he's certified that we have removed everything, a bit of the normal area, then no problem. All you will need to do will be to irradiate the breast. And that will be it. But the problem we have in our own place is that most of our patients present late. And of course, when they do, there's no alternative to removing the whole breast. Now, how do we prevent cancer of the breast? There are some factors that we need to take note of. One, we know that it could run in families. There are some genes that could transmit this cancer, and it runs in families. Now, if you're able to detect that gene in a woman, you have to discuss with her to know the next line of action. Abroad, once they notice that gene, that they are harboring the gene, they just submit themselves to remove their breasts before things go haywire. Now, what about the others? Lifestyle. Again, lifestyle is important. We continue talking about diet. Diet. When we talk about vegetables and so on, we think, oh, the doctors don't want us to enjoy life. But it's there in the Bible. Genesis chapter 1, verse 29. Please, I want you to project it for everybody to see. Genesis chapter 1, verse 29. And God said, behold, I have given you every herb bearing seed, which supports the face of all the earth, and every tree in the which is the fruit of a tree yielding seed. To you it shall be from it. So, right from the beginning, God had prescribed fruits, vegetables for us. But in our own case, we are going for meat and what have you. Now, meat is not bad. But the problem with meat is processed meat is not good. Processed meat. One meat that contains fat, and then meat that is processed, maybe you prefer you smoke it, some of your suya, you barbecue it, and so on. That what you are doing will give rise to carcinogens, things that can predispose to cancer. Now, it is known that cancer of the breast may be more common in some women who maybe the duration of their menstruation in life is very wide. You know, women will tell us that, will agree that the cycle, once there's ovulation, the breast increases in size, isn't it? But after menstruation, it goes down. So there's is waxing and waning, waxing and waning. And therefore, this, along the line, something may happen. So, if you believe that maybe women who have not had issues, maybe women who started menstruating early, we call that menarche, early, or their menstruation stopped late, that's the menopause. In other words, they have menstruated for a long time, and so many other issues. Then, of course, obesity. Obesity is not good. Obesity should be decried. We've talked about some diseases, hypertension, diabetes. We've talked about cancers. But in addition to that, there are other health problems of obesity. Obesity will, of course, will give rise to arthritis. You see, the weight, the knees and ankles bear the weight of the body. If the weight is very much for these joints to carry, of course, you start crying for help. That's your arthritis. Obesity, of course, will give rise to gallstones and what have you. So, you know I'm very fat. But what I would plead with those of us who are on the big side, cut down your ration, and the extra, please, send to me. Send to me so that I will see whether I will add on a little weight, but I'll make sure that I'm not obese in the process. Now, how will you prevent breast cancer? We've talked about all these factors. You need to examine your breasts from time to time. Self-breast examination. A few days after menstruation, please, just go to a mirror. Remove your dress. Raise your hands and look at both breasts. Whether they are equal in size, they are symmetrical, all right? And then you look at the nipple and so on. And then, while still on that, you have to palpate. You have to touch, go around, feel the breast. And the way you do it is, if for instance it is the left breast you want to examine, what will you do? Keep your hand like that. Use this right hand. Don't use the tip of your fingers. All right? Don't use the tip of your fingers. The tip of the fingers are only used for playing the piano and organ. You use the flat of the fingers. And you examine round and round and round, and then you examine the armpit. And then when you want to examine the right, of course, like that, you examine, you palpate, and then you examine the axilla. If you notice any problem, go and see a doctor. Now, if from time to time you are expected to see a doctor to at least feel the breast, all right, to feel the breast, to examine you and make sure that you are not missing out on anything. The earlier you do that, the better. The other issue is mammography. Mammography is just soft tissue x-ray of the breast. If you get to a particular age, you should be doing that regularly. In fact, abroad, they program it. You know, they will be the one to inform you when you are due for that. You do your mammogram. So these factors will help, in reducing the scourge of breast cancer. And then please, we have noticed, unfortunately, that many of our patients, when they come to the hospital and will discuss the issue of removing the breast for breast cancer, they turn it down. In fact, they decide to visit our senior brothers over there. You know who our senior brothers are now? As senior brothers who will get something and be rubbing and say, don't mind those doctors. But what will you see? Eventually, they will come back to us at a very late stage. Some will not be able to walk. For some of them, they are so moribund. That's how it is. So please, when it happens, see your doctor. Like I said earlier on, it is not all cases of cancer of the breast that will remove the breast. If it is caught early enough, you don't really need. All you need to do is to exercise and then you irradiate. There are some other things that should be done apart from surgery. You have chemotherapy giving you drugs, you have radiotherapy and what have you. So that's it for cancer of the breast. Now I will mention prostate cancer, which is about the most common in males. All right, the prostate is a walnut-sized organ that, it's at the base of the bladder, surrounding the urethra. The urethra is that pipe that brings out the urine. Now, it so happens that if there is swelling around the prostate, it could obstruct the exit of urine, and the patient will find it very difficult to urinate. There are two types of problems in the prostate. You have the benign one, and you have the malignant one. The benign one, of course, as we said earlier on, patient will not be able to urinate more frequently, at night, urinating more frequently at night, and from there, so many other complications will come up. Patient will go to urinate, will have to stand for a while before it starts flowing, and it could flow for a while, it will stop, only to start again. And there are some complications. If it is not well handled, infection will come up. Once urine is stagnated, remains in a place for a long time, the bacteria, few bacteria there will start multiplying and will give rise to urinary tract infection. And with this, so many other problems will crop up. And the problems will include bladder stones and what have you. And if that obstruction remains, the pressure will be transmitted to the ureters, to the kidneys, and could have renal failure. It's one of the causes of kidney failure. So, but let's even talk about cancer of the prostate. Cancer of the prostate will present exactly the same way. All right? It's just that the cells are cancerous in nature, unlike the benign one. The cells this time are cancerous in nature. So, we present almost the same way as the benign one. So when you have any issue like that, you should see your doctor. And what the doctor will now do is to carry out a rectal examination. We'll feel the prostate, do a rectal examination, and eventually we order for some specific investigations to look at it. All right? Now, when it comes to the management, just bear in mind that just like we talked about cancer of the breast, it is not all cancers of the prostate that we go ahead to operate or worry about. It depends on the rate of growth. They carry out the biopsy, they discover that, this is a slow-growing tumor in an 80-year-old. In other words, by the time the man is 80, 75, 80, you discover that by the time the man gets to 90, the cancer is still growing gradually. So you just continue to watch him. You may not do so much. But there is the other one where you have to be very, very careful. You are watching the patient, but you are prepared to intervene if something happens. And it gets to a point where you may have to place on drugs. The basic problem in this situation in cancer of the prostate is that the testosterone level is very high. It's very, very high. And with that, so many problems will occur. Now, I forgot to mention PSA. We'll talk about that in the prevention. PSA is very important. You need to monitor your PSA level. We said that when the cancer is raised, yes, when the cancer is coming up, the PSA will be rising. So check your PSA and of course see your doctor. Let me stop for now. But colorectal CA, very, very important. In fact, recently so many people I know are involved in this. So colorectal CA, change in bowel habits. The patients who have been stooling regularly, who start getting constipated and what have you, passing blood in stool. When that happens, see your doctor. Your doctor will request that the colon should be examined by way of a colonoscopy. And that could run in families too. So, but if you have a family history of it, then the earlier you start scoping yourself, the better. So, let us stop at this, and if you have any questions to ask,